Hey everybody, welcome to the Amigo Gringo channel. I'm doing this video in English because I think a lot of people will want to watch, including members of my family. I'm going down by bike to Jamaica Hospital, which is not very far from my house, to interview my cousin, who's a doctor who works in Colorado and lives in Colorado, but has come to New York to work in this crisis. And of course, Queens, especially this part of Queens, is the hardest hit part of the city. I weighed the risk of seeing him personally instead of doing it by Zoom, and thought it would be more valuable to see the actual hospital, see him right after he got out of the shift. I hope that's worth it. Okay, go for it.
Hello, I am Dr. Jeffrey Alpert from Denver, Colorado, although I grew up in Rego Park, which is a stone's throw from here, and then in Manhattan as I got older. Seth Kugel is my first cousin, my first cousin.
Yeah, I'm your first cousin?
That's right.
You're the best cousin.
That's, well, and you too. I came back home to volunteer to work at Jamaica Hospital. I'm with right behind us. I work with Heart to Heart International and International Medical Corps. I just got off my night shift, 7:30 to 7:30 p.m. to a.m. Working in the emergency room.
Why did you decide to do this? You're obviously in an age. You're even older than me, which is hard to believe.
That someone is older than you,
you're
yes.
At a risk. You definitely have risk factors for the disease. Why did you decide to do it?
Because they needed help. I mean, I don't know how you say no. Right. You know, they needed help, and the doctors and nurses are overwhelmed. I mean, they're exhausted. Probably a quarter of them have had the virus. The head of the emergency room was hospitalized at another place getting an experimental drug. He just came back Monday. It's intense.
Typically, what are you doing with these organizations? You're not working in the U.S., are you? Or
no, most of it's been international.
What are some examples of that?
I've been to Haiti, eight different trips since the earthquake, the Philippines, China, Nepal. And then I was in Houston after the flood recently. So,
how does this compare just in terms of facilities or craziness?
It's a big New York City hospital. It's not the Ritz-Carlton of hospitals in New York, but it serves the neighborhood very well. The nurses and doctors and respiratory therapists are phenomenal and welcoming, and they've been wonderful to us, grateful for our help. Everything you read about COVID is true. It's 80-90% of what we see is COVID or suspected COVID. Putting lots of people in the hospital, although there are no beds upstairs, so usually people just stay in the emergency room for a day or even two.
Well, take me through the shift then. You came in last night, and what did you do for 12 hours?
Well, you take over the last shift's patients. I had 4, and then we had one was certainly COVID, he got admitted, and then we had one in the middle of the night who was also COVID, and he'll be admitted. I don't know how many overall, but probably a dozen or more at least a day, probably 20 or more a day are admitted with presumed COVID.
And what happens? An ambulance usually brings them in?
Most of them. They said last week they were having 80 to 90 ambulances a day bringing patients, and easily 80% are suspected COVID, respiratory problems, can't breathe, cough, fever, weakness. There are lots of other symptoms as well, but those are the main ones. And
do you think, we've been instructed to, until we have real breathing problems, to not come into the hospital. Do you think some people come in too late, or?
That's a good question. We cannot get patients tested unless they're being admitted.
Wow.
You have to call the state, and they go through basically a 10-minute questionnaire and give you approval, give you a number to get tested. I mean, there may be testing centers in the community. I don't know. I assume there are. Maybe not. I know that's been a problem in the U.S.
Shouldn't you just have endless tests that you can just give to people when they come in?
That would be nice, and especially for epidemiologic reasons and sort of surveying what's going on in the country and if it's peaking or still a logarithmic increase. That would be nice, but it doesn't exist here.
What about equipment that we hear so much about?
You know, here we are fully gowned in face and mask and hair, and so equipment is not protective equipment for the doctors and nurses and employees, you know, house staff, housekeeping, respiratory therapy. It's not been a problem here. I don't know about other hospitals.
Are these N95 masks? I mean,
yeah.
Is that what you have on
yeah.
now?
Yeah.
So is that like sealed to your face or something? How does it?
You have to get it fitted, ideally.
Right.
And theoretically, it will prevent the droplet spread or protect us.
Whereas this is not doing much more than if I sneeze, not letting
exactly. Yeah, your mucus to
just
spread.
To breathe and
yeah.
give the atmosphere.
Exactly. Yeah.
Can you just take me through what happens to a patient when they come in?
Well, the nurse triages them, checks their vitals, their oxygen, basics. You know, get a few sentences of why they're here. But like I said, it's almost entirely one diagnosis. The pediatric ER they were saying 75 patients a day normally. They're down to 0.
Wow.
There are no kids coming in. They've converted the pediatric ER to a COVID unit.
I guess if your kid is sick, the last place you're gonna bring them is to this hospital.
Yeah, I mean, if you don't have to come here, don't, because you will be exposed to COVID.
When someone comes in and then they see you, what are you doing?
I mean, if their oxygen is below a certain level, they're getting oxygen right away. We examine them, but basically we're not using stethoscopes anymore. It's really the numbers, their work of breathing, their mentation, how they're speaking, if they're making sense. Your oxygen gets too low, obviously your brain doesn't function. And then you can just put nose or oxygen up their nose, put a mask on. Initially, a month ago, when this sort of started, the thought was put a tube down into their lungs to help them breathe, and do that early.
The famous ventilator.
Right, and that's why they thought they were going to need 100,000 ventilators in New York. That thought has changed entirely, because 50 to 80% of people on ventilators were dying. So now the thought is try everything before intubating, putting a tube down their windpipe now. So it's really changed, and there's certain maneuvers that we do on patients to try and get oxygen into their lungs, to flip them on their belly, on their side, and it works. I mean, we just had one, maybe it saved his life, I don't know.
How old was he? What was the situation?
He was older. I'm sure he has COVID, no question. So there are things that the experts are telling us to try, and the experts who have been in New York for a month are saying to try before intubating, because intubation is, over half of them die. That's pretty sobering.
So does anybody get intubated in the ER?
Yeah.
So did you have to intubate anyone yesterday?
I did one last night and one the night, 2 nights ago when I worked, yeah.
And those are people who are, it's like...
Well, they're going to die if, they're going to die if you don't.
how does it work? Is it like we hear about they put something over their face or so that they can block the spraying of...
Yeah, it's not as easy as that, but...
Well, can you tell us who is involved in an intubation?
You'll have the respiratory therapist, usually another doctor, myself, and a nurse. A nurse will give the drugs to paralyze the patient because you don't want them fighting putting a tube down, because they'll just pull it right out, obviously. But once they're paralyzed, it's usually pretty easy. Not always, but...
I mean, that sounds terrifying for the patient. Are they also not aware of...
Yeah, no, you give them a sedative and then paralyze them. Yeah, of course.
That theoretically could be the last time they have a chance to send a message or something like that?
If you have time and it's not an absolute emergency, you could have them talk on their phone to their loved ones. We can talk to their loved ones. But if it's emergent, no go, and their family is not allowed in the ER, so they're alone, and that's rough.
Obviously, in the emergency room, people are pretty distressed
right.
at the time. Which is any different?
If their oxygen's really low, they're usually fairly confused, so it's not. But before that, yeah, the last place they want to be is in the emergency room. At this point, like I said, almost all of people have COVID or suspected COVID. They're distressed being there because they think they're going to get it if they don't have it already.
Right.
It's pretty stressful. Yeah, it's and you have in the main emergency room there are probably 30 beds, 30 patients, and most of them are on oxygen of some sort. A few people are on ventilators because they have nowhere to put them. There's the intensive care unit is full. What's
this sort of the staff mood, if you can possibly describe that?
I mean, they're professional. But they're stressed, tired. What I've heard several times is, when will this end? And I don't think anyone really can tell us.
It strikes me that you're living in this completely different world than I am. Like when I came to, this is like my first time in public, or the first time out of my neighborhood. Have you been thinking about like all these people staying at home and doing nothing?
Oh yeah.
I mean, it's what a contrast.
Well, I'll have to do that when I go back to Colorado. I have to, part of the agreement was that you quarantine yourself for 2 weeks.
How long are you here for?
Essentially 2 weeks. A day of orientation and getting settled. But
can we go back, can you just take us through a few of the patients that came in? I mean, we had that one guy who was elderly. Are they white? Are they black? Are they old? Are they this class? Are they,
Queens and this area is one of the most diverse places in the world. So this was a rough estimate, 30 to 40% black, 20-30% Hispanic, Indian, Pakistani, Caribbean descent, a few whites, 10%. Earlier tonight I had a gentleman, 2 to 3 day history of cough, increasing shortness of breath, some diarrhea. We see that over and over again. That was pretty classic. He was a very nice gentleman, probably in his 40s, maybe early 50s. But his oxygen was such that you can't send him home. He's got to come in the hospital. And we did the COVID test. The turnaround here has been 24, 48 hours. So they'll find out tomorrow. But he has it. I mean, if it quacks like a duck and looks like a duck, it's a duck.
I know everyone asks this, but if someone in their 40s, does he have some sort of medical history that?
Without giving too many details, yes. I think, rates of diabetes, hypertension, obesity, cigarette smoking. The exam's pretty simple. It's not like we usually do because, like I said, we know what we have to do. We draw blood, and there are certain interesting blood tests that are just totally out of whack with COVID, just astoundingly. One of the types of white blood cells is lymphocytes are almost absent, which is unusual in a virus. Usually they're high. A certain blood test for blood clotting, for blood clots, is extremely high in almost everyone. So there's a thought that the virus somehow affects some of the clotting factors, and they're putting everyone on blood thinners who gets admitted because of that. We don't really understand the disease fully. It's sort of a work in progress. Everyone who gets admitted is put on hydroxychloroquine. The newer studies are less impressive than the early ones that have come out in the last few days. So I have mixed feelings about it. They've stopped using the azithromycin because it's been affecting heart rhythm more than I think is in the press. I think they had someone almost die because of it. So they've switched to a different antibiotic.
What do the patients ask you, or what do they say? Is there a pattern? I mean, what do they want to know? Am I going on a ventilator? Or?
Yeah, they'll ask, and we tell them we're going to do everything to not do that. We have several things we can do. Little CPAP masks that we use for sleep apnea that are uncomfortable, but they're better than a tube down your throat. We'll do that. Something called a non-rebreather. You can give very high amounts of oxygen. Those are the two main things that we'll try. And then putting them on their side, on their belly. I have nothing but great things to say about the doctors, nurses, the housekeeping staff, the guards, the therapists. I mean, they're just working just unbelievable hours because several of them are sick or out. And that's why my organization came with some doctors and physician assistants. We're trying to get nurses and respiratory therapists just to give these people a break. Because you can't keep doing this for working this hard.
And of course, you realize being here that all these people walking by have a million different jobs.
Right,
it's not just
right.
Doctors and nurses.
No. Yeah, no, it's the people cleaning up after a COVID patient's been moved, to a room. I mean, they're as exposed as all of us.
So tell me what you're going to do now.
I'm going to get to my hotel, which is by the airport, JFK, take off all my clothes, put them in a bag, jump in the shower, put on clean clothes, and go to bed.
Yeah.
Well, eat breakfast or dinner or whatever, some food, and then go to sleep. I'm off tonight, so that is nice.
So
yeah.
What are your plans? Obviously, it's not a big night out in the city.
I am actually, being a New Yorker, I'm going to drive to Katz's on the Lower East Side and introduce the people from out of state, which is everyone else, to Katz's.
Katz's is open and functioning, I assume?
Well, to take out, yes. I've checked that.
Okay. Should you be touching your face with your
No,
hands?
but it's very annoying.
Okay.
It is very hard not to.
Yeah. Okay.
Try wearing this for 12 hours straight, yeah.
Okay. Well, thank you very much for coming to New York. Obviously, I could be me in there. And,
Well, just keep isolating and...
This is the least isolated I have been. Jeff, I really appreciate your speaking to me and also being here. And did you have a little Portuguese that you wanted to say?
It's obrigada. Is that goodbye?
Obrigado. That's if you're a woman.
Obrigado. Okay.
Well, I don't know why you would be. Why don't I just say obrigado to you?
Okay.
Instead of you saying it to me.
Obrigado. Right. And yeah, the only other Portuguese I know is bacalhau, which is cod, right?
Yeah, exactly.
I did do a bike trip in Portugal, so I
Okay, but you have not been to Brazil. People will always.
No, but you will show me around someday.
I will definitely.
Yes.
All right, awesome. I'm going to turn this off.
All right.
Here. Thank you very much. If you could just take off that mic.